It's important to get your daily dose of vitamin D, and there are different ways you can get it. Dr. Bodemer with UW Health joins us now to talk more about this. So, Dr. Bodemer, what is vitamin D and what does this do for us?
Vitamin D is a fat-soluble vitamin which is synthesized in the skin with exposure to UVB radiation. And I do want to stress that it's the UVB wavelengths that result in the formation of vitamin D, because tanning booths offer primarily UVA radiation. So not only are they dangerous in terms of dramatically increasing the risk of skin cancer and accelerating the rate of aging, they also really don't do a whole lot to boost our vitamin D levels. In terms of what it does, its primary function is to support and maintain bone health. There have been some associations with low vitamin D level and some cancers, some mood disorders, fibromyalgia, hair loss, and psoriasis. However, the nature of this relationship isn't really clear at this point.
So I know one of the ways to get vitamin D is through sunlight, but that's not the only way. What are some of the only ways to get it?
No, it's not. So the foods that contain vitamin D are primarily fatty fish and eggs. However, there are a lot of foods that are now supplemented, and these include dairy products, non-dairy milk products like almond milk or soy milk, cereals, and even orange juice. And then finally, supplementation with some of these types of vitamins are a really great way to safely get your vitamin D.
So if someone were vitamin D deficient, how would they know?
Well, really the only way to know is to get a blood test. When vitamin D deficiency shows up with symptoms, it's really very severe. So the people that tend to be at risk for vitamin D deficiency include infants, elderly, people who are obese, people who are institutionalized or disabled and unable to get outside, people who practice really strict UV avoidance, and that can be for reasons like lupus or other photosensitive skin conditions, and then people who have gastrointestinal disorders that result in malabsorption, like Crohn's or celiac disease.
So can people overdo it? Is there a way to maybe get too much vitamin D?
It's really difficult. So when you're talking about UV sources of vitamin D, we have a natural feedback loop that inhibits our bodies from gathering up too much vitamin D. And that UVB both makes vitamin D in the skin and it also deactivates it. In terms of supplements, we know that there have been no adverse events seen in people who take up to 10,000 IU a day, and some experts feel that that number probably is higher, closer to 40 or 50,000 IU. I wouldn't recommend taking those super high doses unless you're advised by your physician.
So you mentioned this unit IU. What does that mean?
Okay, so that stands for International Unit, and it basically is another way for us to measure the amount of drug or vitamins in a supplement or a pill. When it comes to vitamin D, it's about 40 IU is equal to 1 microgram, or that's 0.001 milligram.
So as far as supplements, how much of these supplements should we be taking?
Well, the recommended dietary allowances are set to make sure that 97.5% of the healthy population will have adequate levels in terms of prevention of disease. It doesn't really tell us what optimal levels are, and we don't really know that exactly right now. But a good rule of thumb would be for adults, it's around 600 IU a day. That also takes into account is taking into account that the people taking it would have minimal UV exposure. So that gives you a really good baseline to have a minimum amount of that, either in your diet or from supplementation.
All right, Dr. Bodemer, thank you so much. I know I have learned a lot and need to get those IUs in every day. We really appreciate you having you here. Thanks so much.